Good morning. Okay. I really would like to start by thanking the organizers, especially Helen, for inviting me and giving me the opportunity to speak about public health challenges in Africa. The title of my presentation, for anyone who knows Africa, may create some consternation because you're talking about a continent with 1.24 billion people and about 54 different states. And the diversity across these 54 nation states can often be larger than the diversity between Africa and the rest of the world. I will therefore paint in broad strokes, a picture that gives voice to health status in Africa, highlighting few of the challenges the continent currently faces and the factors that frustrate even the best efforts to improve public health on the continent. Recognizing the theme of this Congress is on voices, vision, and action, I will discuss the tremendous opportunities that, that give me hope and the action that we must take for sustained improvement in public health outcomes in Africa. One of the many tragedies of negative media reports on Africa is that they often do not allow us to celebrate some of the progress that is being made in the region. Although Africa missed the MDG targets, the continent recorded impressive reductions in many of the targets, especially the health targets, including under 5 mortality rate, which declined by almost 60% between 1990 and 2015. Declines in maternal mortality was less impressive at 44% over the 25-year period. Still, at 542 maternal deaths per 100,000 live births, these levels are still unconscionably high. Despite substantial improvements in health outcomes during the MDG era, when Africa is compared with the rest of the world, Africa still faces huge deficits that is manifest in nearly 30-year lower life expectancy than in some of the high-income countries. Africa currently faces what we call a quadruple burden of health problems. There is the unfinished agenda of infectious diseases, the continuing persistence of maternal, newborn, and child health problems, emerging burden of non-communicable diseases and mental health, and the surge of injuries and accidents. The interaction of these, coupled with the often ignored environmental challenges, frustrate efforts to improve public health in Africa. With respect to the unfinished agenda of infectious diseases, there are 3 main categories of this. Africa still bears disproportionate burden of the major epidemics, including HIV, TB, and malaria. It is dealing with the re-emerging diseases from neglected tropical diseases, such as schistosomiasis, lymphatic filariasis, trachoma, and the rest of them. Emerging epidemics like the Ebola epidemic, which recently laid bare the national health system challenges in West Africa, complete the trio. The second burden is NCDs. Africa has been facing a growing epidemic of non-communicable diseases. A recent WHO report on NCDs shows that NCDs account for more than a quarter of deaths in many parts of Africa. And in the southern parts of Africa, it accounts between a half and a quarter and 3/4 of the deaths. The third burden is persisting maternal, newborn, and child health challenges in the region. Despite the investments made and progress achieved to date, maternal and child health indicators are still high in Africa. The graph shows that the comparison of 2015 levels of key maternal and child health indicators and the corresponding SDG targets. Under 5, maternal mortality is far from the target. Under 5 and neonatal mortality rates have to decrease by more than 3/4 if the SDG targets are to be met in Africa. The fourth burden is the surge of accidents and injury-related deaths. The slide shows the comparison of road traffic fatalities and the number of vehicles per 1,000 population by world regions. Although Africa has the lowest number of vehicles per 1,000 population, it has the highest fatality rate. If these dynamics are to continue, and there is more vehicle ownership with improving economic conditions in the region, the problem will only get worse. Africa's capacity to sustain the recent improvements in health outcomes is constrained by 5 main factors. These are rapid population growth, rapid and unplanned urbanization, environmental factors, growing inequalities, and weak health systems. In 1950, Africa accounted for less than 10% of the world population. Today, its share has risen to 17%, and it is projected to reach 26% by 2050 and about 40% by 2100, with 4.4 billion people. The rate of growth of the population does not allow for meaningful human capacity investments and raises questions on what type of 4.4 billion people will this be by 2100. Would these be poor, sick, and uneducated individuals needing continued support to survive, or would they be healthy, educated, and productive force that can transform Africa? It is harder to achieve the latter at current rates of growth of the population, which stands at 2.5% per year. Although Africa is still the least urbanized region of the world, it is the most rapidly urbanizing region. Most of this urban growth, unfortunately, is unplanned or poorly planned, and nearly 60% of Africa's urban population currently live in places termed slums, with often lacking access to basic urban infrastructure that further increases their risk to poor health. With urban growth and poverty, while urban growth is often associated with economic growth, transformation, and poverty reduction, how much of this will be realized in Africa remains a question, as urban areas are shown to have the highest levels of inequality and as slums continue to characterize the face of urbanization in Africa. Africa's environmental challenges go beyond climate change and have enormous implications for health. From inefficient agricultural practices and rapid urbanization that are leading to massive changes in land use, to loss of forest cover and loss of biodiversity, to rapid population growth that will require Africa to feed more than double its current population by 2050. Every year, different parts of Africa face drought. This table shows the major droughts events in Africa since 1980s. Currently, Eastern Africa and the Horn of Africa, and even Southern Africa, are facing drought that is believed to be due to the effects of El Nino. The confluence of these environmental factors, combined with climate change and their implications for food production, pose real challenges for sustaining improvements in health in Africa. Over the years, we've seen between 2000 and 2015, Africa experienced some declines in gender inequality, but income inequality has remained unchanged in the region. Strong and resilient health systems is at the core of public health. Health systems in most African countries are challenged by critical shortages and distributional disparities in human resources. These health systems also have low absorptive capacity of resources such as those from Global Fund and PEPFAR. They are also easily challenged by epidemics such as Ebola. It is very easy to lose heart when confronted with these challenges and realities in the region. However, this Congress is also about vision and action. So despite these challenges to public health in Africa, there are a lot to be hopeful for. There are tremendous opportunities for public health improvements in Africa, and I would like to highlight just 5 of these. Economic growth in Africa is real. About half of the countries in Africa will achieve middle income status by 2030, with an opportunity for greater domestic investment in health programs. And by 2020, about 50% of households in Africa are estimated to have disposable incomes and can easily invest in improving their health. Secondly, there is the growing political space across Africa. In countries like Ghana and Kenya, political space for advocacy is improving. Nigeria and the Gambia are examples where, for the first time in their history since independence, the government handed over power to someone in the opposition, even if it is by force, like in the Gambia, or threat of force. Other countries are likely to follow these promising examples. The greater attention given to ending major epidemics, including global investments for HIV, TB, and malaria, and immunizations like the Gavi, are opportunities to strengthen health systems in Africa. Fourth, the existence of strong partnerships at global and regional levels could improve collaboration in addressing health challenges in Africa, and continental and sub-regional cooperation in disease surveillance and an emergent African academy are all relevant developments that can be leveraged to sustain health improvements in Africa. Finally, despite projected population growth in Africa, this does not necessarily have to be the destiny of Africa. A number of countries like Rwanda and Ethiopia have shown that we can achieve significant increases in contraceptive use and reductions in fertility in a relatively short period of time. The commitment of African heads of state to realizing the demographic dividend is a unique opportunity to fast-track human capital investments to achieve the dividend, and this has the potential to improve health in the region. What is the future trajectory of public health in Africa then? For me, I believe Africa can expect, under the SDGs, to achieve many of the health targets. Achieving these will require evidence-informed policies and interventions, especially from context-specific applied research conducted in the region by Africans. Achieving these targets will also require Africa to address massive income and gender inequalities and to pay special attention to targets with low starting points like maternal mortality. Progress will, however, not be uniform across the SDG targets. Targets such as strengthening domestic funding systems can be readily achieved in Africa, while those where Africa is already highly disadvantaged, like reduction in maternal mortality, may be harder to achieve without concentrated effort to accelerate local action on them. In conclusion, I offer 4 key reflections on the new frontiers for public health in Africa. These are areas where current trends suggest that Africa is heading in the wrong direction, and without definitive and consensuous action, will likely frustrate other efforts to improve public health in the region. First, we must address the health of slum populations. The continued invisibility of nearly 1 billion people that live in slums in low and middle income countries in national and global data systems needs to be addressed urgently. Indeed, wherever the evidence exists, the difference in health outcomes between slum areas and non-slum areas, or the urban average in particular, is often larger than the difference between urban areas and rural areas, which means that the urban indicators we get in many times is meaningless and reflects really nothing than the distribution of slums and non-slum areas in these places. If we can simply include in our national censuses an identifier for slum clusters and be able to sample within that domain in national surveys, we can actually remove this veil of invisibility. It will facilitate studies of the neighborhood effects that determine health outcomes in slum areas and how interventions can be calibrated in slum areas to achieve the right dose effect that translate into impact. Secondly, we must address the role of waste management in Africa. From solid waste to fecal and air pollution, these are real challenges in Africa. It is unfortunate to see much global media attention to the recent landslide in the Koshe garbage landfill in Addis Ababa that killed less than 100 people, while thousands die each day from exposures to poor waste management, and that remains invisible. Thirdly, we must combat environmental challenges to health in Africa. The most concerning for me is the killing of African lives on the altar of corporate profits. African countries export some of the cleanest crude oil, for instance, with the least amount of sulfur content. These are refined overseas and shipped back to the continent loaded with sulfur and often labeled African standards or African quality, which cannot be sold anywhere else. As public health community, we have an obligation to stand together for the global application of standards without exceptions. Finally, we must address the issue of violent deaths in Africa. From the work we do in the slums of Nairobi, in 2003, when we started this longitudinal study, accidents, injuries, and interpersonal accidents accounted for only about 10% of the deaths that occurred in the slums. 10 years later, by 2013, it accounted for about 22% of the deaths. And for adult males, it is the leading cause at over 40% of the deaths. Slum health, waste management, environmental challenges, and violent deaths constitute the new frontiers for addressing public health challenges in Africa. And I believe this is also the case for many low and middle income countries. Thank you.